Hello, everyone. So welcome to the professional development webinar series by the Counseling Psychology section of the Canadian Psychological Association. My name is Hou Yuan. I am the past chair of the Counseling Psychology section, and I'm going to be the host of this webinar. So today we are having a very exciting topic, working in private practice. And so let's start with land acknowledgement. So we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. So Toronto, is where I'm at. Is covered by Treaty 13 signed with the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and the Chippewa bands. So I would like to invite every participant to have a land acknowledgement in the chat box. So a little bit of introduction to our section. So we are a counseling psychology section of the CPA. So we are representing counseling psychologists, researchers, students, and the community partners nationwide within CPA. So here's the webpage of our section and the website. So we are actually having a series of professional development webinars, and this is our latest one. And like I said, it's a very exciting one. And we also have two wonderful speakers today. Both of them have a very rich experience in running successful and reputable private practice in Greater Toronto area. So the first presenter, Dr. Elena Denisov. So prior to her retirement, Dr. Denisov was a clinical director and a professional practice leader at a large private practice in downtown Toronto called CBT Associates. And she received her PhD in clinical psychology from York University. She completed her pre-doctoral training at the Clark Institute of Psychiatry and the Toronto General Hospital. Dr. Denisov has worked as a clinician, teacher, researcher, and an administrator in a wide variety of inpatient and outpatient settings, including at Anxiety Disorders Clinic at the Center for Addiction and Mental Health in Toronto, and as the head of the clinical treatment team at the Psychological Trauma Program. Dr. Denisov has also served as an assistant professor in the Department of Psychiatry at the University of Toronto, and she has been involved in training and consultation with mental health professionals in Canada and internationally. At CBT Associates, Dr. Denisov provided CBT for adults with anxiety disorders, depression, and other mood disorders, and related problems. So actually, I did my pre-doctoral internship in CBT Associates. So very good experience there. So second presenter, Dr. Noah Lazar. So Dr. Lazar is the co-founder and clinical director at the Downtown Psychology Clinic in Toronto, a large private practice. Dr. Lazar completed his PhD in clinical psychology at Western University and completed his clinical residency at St. Joseph's Healthcare, Hamilton, in their mood disorders clinic, neuropsych services, and their schizophrenia and severe mental illness clinic. He also worked in numerous inpatient and outpatient psychiatric clinics before beginning work full-time in private practice. He's also an adjunct lecturer with the Department of Psychiatry at the University of Toronto. So Dr. Lazar is certified by the Canadian Association of CBT in the provision of CBT and works with clients dealing with for a wide range of difficulties, including depression, schizophrenia, and psychosis, as well as anxiety, with particular interest in generalized anxiety disorder, OCD, panic disorder, agoraphobia, and social anxiety disorder. So I also currently work at the Downtown Psychology Clinic. So that's why I'm so excited and honored to have both of them to share their wisdom and insight in running private practice. And now I will pass the floors to the presenters. Let me here, yeah.
So I will just get our screen share going, and we're going to be monitoring the chat. So hopefully we want to be able to answer as many questions as possible, because I know there's often questions that people have about this particular topic. So we're going to try to sort of go through a bunch of information on each slide, and then we'll maybe hold questions towards the end of those, and you can put them in the chat and we'll read them out to you. Give me 1 second. I hope everybody can see that.
Yeah.
Okay. So maybe I'll let you get started, Elena.
Absolutely. So I guess good afternoon, everybody, and thanks for coming to listen to Noah and I talk about private practice. And the reason Noah and I thought about doing the presentation together is because I retired just prior to COVID, and we really believed that there would be different questions about private practice kind of before COVID and after COVID. And between the two of us, we really hope that we could answer a lot of those. Some things definitely stayed the same. And of course, other things did not. So our hope is that we could answer questions for you as you make your decisions about private practice. As Huyan explained, both Noah and myself were working in private practice before COVID, and and then Noah went through that transition, and we've both had significant experience working, in different hospitals, inpatient and outpatient units, and and in private practice. So hopefully, between the two of us, we can answer a lot of your questions. Noah, anything to add?
I should also add, I have also worked at CBT Associates, and Elena was my supervisor and sort of mentor. And a lot of what I've learned about private practice has really come from her expertise. So hopefully we'll have a lot to share with you today.
And I think just on the topic of sharing, I think both Noah and I have always valued the importance of mentorship and about helping others out. And so it hasn't, even though I have retired from clinical practice, as my husband says, I didn't really retire. I just consult for free. But I think both Noah and I often chat about, so many people coming into psychology and having questions. And we've both been, very open and are happy to kind of entertain people's questions, help them make decisions, and think about what's best for them at any given time. So hopefully that continues. As he says, my husband says that I now consult for free. So a lot of the questions we hope will be answered in today's presentation. But if you think of something afterwards, I really don't mind if somebody contacts me. That's always been the policy, is just helping each other. It's one community. And there's definitely a lot of work for everybody. And so thinking about how to best do that. I think that both Noah and I will agree that there are many benefits to working in private practice. And some of the benefits that you can anticipate, for a lot of people that I speak with, and certainly for myself, as I moved from my positions at the Center for Addiction and Mental Health into private practice. And I did both of them for a considerable number of years before moving exclusively to private practice when the needs there were just so demanding. But, things that were important to us were things like the flexibility of hours, the flexibility of work. And that's definitely something to think about. Personally, in the private practice, we opened a private practice in downtown Toronto in 2002. And at that time, there weren't many private practices there. I was working at the time at the Center for Addiction and Mental Health. We wanted to make sure we were in no way competing with the Center for Addiction and Mental Health. And the demands there, the waiting lists were long. And as a result, at the center at that time, it was always group therapy that was offered. And we offered individual therapy at the private practice. And it didn't take long for the practice to begin to grow. Flexibility of hours, it's an interesting concept. You do have flexibility, but as as somebody who's working in the practice and someone who's a director at the practice, the hours can be very long. So there are your clinical hours and then, all of the other work that comes with private practice. Most people express at least a little bit of hesitation, anxiety in a normal range about making that transition. And I think that it's definitely worth thinking about, and hopefully we'll cover a lot of those questions. So definitely flexible work hours. When we had the private practice downtown, there was consistently a significant amount of demand for clinical services after the 9 to 5. Lunchtime was often very popular as well. People would take time off during their lunch hour to come in and meet with their psychologist. But really from kind of 4 o'clock on, right through till 9 p.m., people were, those work hours were consistently in high demand. Office space was in high demand. Clinical time was in high demand. Those were things we had to consider at the private practice, both, for ourselves and for people who worked with us. So sometimes really making requests of people to offer some hours during those high demand times. Greater autonomy. Absolutely, there's greater autonomy. You don't have the constraints of having to follow kind of the rules of the organization that you're working within, because you're essentially a contractor at the private practice. And for those reasons, you really can be flexible about how many hours, which hours you offer. And those are things you'd have to discuss and work on with the director at the practice. In terms of greater diversity of clients, really something important to consider. As Noah said, he came to the practice with exceptional experience working with clients with psychosis, in addition to working with clients with anxiety disorders. And he could continue to do that work at our practice. I was able to supervise Noah in that work because I had experience with it. One of the things about when you're working in a larger center, we did have associates at the practice who worked with psychosis, but we certainly wouldn't expect everybody to work with clients who presented with psychosis. So some of our associates worked specifically with clients with social anxiety. Others worked specifically with clients with OCD. Those were areas they were most interested in and the clinical work they wanted to do. Others wanted a much more diverse clinical exposure, so different kinds of presentations. And those people were able to get experience working with depression, a range of anxiety disorders, and many other clinical presentations. So definitely something to consider. Again, if you're in a more remote area, you may have to be more of a generalist. You want to get that experience and have those opportunities, perhaps before going into your private practice. But if you're in a large center and you really want to, get into a lot of detail and be somewhat, expert, without making that claim, but, you really want to focus on a particular area, you're also likely able to do that. And then, of course, the income question. My experience has been that for a lot of people, there's a concern about, the stability of the income and the amount of the income. Why wouldn't there be, right? Very, very natural things to think about. And my experience with private practice is that there is room to make a good income. There is responsibility that comes with it. And we'll talk more about some of those things. But you can try it out gradually, perhaps, and, do, for some people, they're part-time in working at an institution and part-time in a private practice. When you compare the income potential I still believe that there's, a very good opportunity to make as much and more income, depending on how much you're willing and able to work in the private practice. But there is definitely opportunity to make a very good and comfortable income. Noah?
I'll maybe just throw in from my experience. So I came out of residency and went directly into private practice working with Elena. And, at that stage in my life, for example, I was very much a night hawk. So the flexibility of the hours worked out very well for me. So I could start some days around noon and go until, 8, 9 o'clock at night. It kind of suited me well. If I needed to take an afternoon off, there was an ability to reshuffle clients in a way to make sure that, you're still providing clinical care, but, you wouldn't have to necessarily submit a vacation request or, say I need this afternoon off. It was something that as long as you were taking care of your clients, you did have that flexibility to do what you wanted. And I find, when we're talking about greater autonomy, I do some consulting with some various hospital programs, and a lot of times at least with some of the ones that I've worked with, there might be very particular protocols you have to follow. So, everybody is being put through the unified protocol in that program, and you might have a little flexibility of, the unified protocol doesn't really, for example, in CBT talk about behavioral activation, but you can probably sneak it in somewhere. The benefit of having sort of when you're in private practice is you're sort of in control of your treatment. So if I want to do the treatment in a certain way, or I want to pivot at certain points, you don't have to stick to a manual. You don't have to finish in 12 sessions and that's it. If the client can afford to continue coming or has coverage, you can try to change the focus or approach it in a different way. Similarly, if a client can only come for 4 sessions, you also have the ability to modify your approach to ensure that you can sort of meet their needs. So you really do have a lot of say in the way that you're going to be treating and sort of directing the treatment for that client. And I often found, especially once I hit private practice, that diversity was really important. So, when I was working in some of the psychosis programs, it's a very challenging population to work with. And so doing that day in, day out, and some of my colleagues were, they may work in a trauma program. And so every day is listening to various traumas. Being in private practice, you can still do all that because the demand is there for private practitioners to do that work. But there's also an opportunity to say, I'd like to, max out my psychosis clients at this many per on my caseload. And because I have control of my schedule, I'd like to, try to keep, 2 really challenging clients per day and intersperse them with other things that might be, maybe a little less challenging or tap other interests that I might have that I want to be sort of doing clinical work in as well. And one of the things sometimes our trainees often find, which is often an interesting piece of feedback, is that when they've worked in certain hospital programs, they go into an OCD program or they go into a mood program, they get a lot of clients who obviously meet criteria for those particular diagnoses. And in private practice, you also get a large chunk who don't necessarily meet any kind of diagnosis, but they're trying to navigate the end of a relationship. They're trying to deal with life transitions. So a lot of non-clinical presentations that are really interesting and great to work with that you might not catch always in sort of other settings because they wouldn't meet diagnostic criteria to really even be admitted into the program. And what I'll say is on the increased income front, typically when you're sort of working in a contractor model, the client is charged one fee and the associate will bill the private practice, a portion of that fee essentially. And I found that in general, it's not hard to get a good caseload going if you have good experience and you do good work. And I would say I never really had financial concerns myself, even when I was, in sort of supervised practice and was fresh and green and so on. It was always something that it never turned out to be a huge problem. Because although you may not get paid in the same way, you usually only get paid when you see a client. And in a hospital, they might be paying you for your full 37 and a half hours per week. I would always do the calculations. I'm kind of a numbers guy. And so, if you saw 5 clients a day in the hospital and what that would look like, and if you saw 5 clients a day in private practice, typically, even though there's a bunch of unpaid hours in there, you do tend to do a little bit better.
Fair. That's good. I think those are all important points. And I think some of the things, and Noah will most likely agree, maybe not. Happy to hear any additional ideas. But part of building a successful private practice for us was about being evidence-based, right? So as Noah says, you don't necessarily have to stick with a 12-session protocol. Some clients might need a few more or a few less. But it is important, I believe, and it was for us, and our practice actually grew year over year by about 20%. So our practice grew bigger and bigger every year by about 20%. And that was very good for any small business starting out. But we didn't know that, of course, until years down the road. So we just worked hard. We provided evidence-based care. We weren't shy about that. We also asked our associates to do semi-structured diagnostic interviews because we felt that was important in a practice in terms of helping us know where we needed to go with a client and helping them understand. And we got a lot of very positive feedback about that, whether it was from the clients directly or from parents of children who came to the practice. They really appreciated having that clarity. And so I think for us, doing evidence-based work was important. And personally, when I started working at the Center for Addiction and Mental Health in the Depression Clinic, we were doing 16-session protocols. There was also a lot of data being collected at the time and looking at outcomes. We were treating depression. It was cognitive behavioral therapy as the approach. And we looked at outcomes. And because there was such a demand, before long, the group therapy sessions were decreased to 14 sessions. The outcomes were the same. Then they were decreased to 12 sessions, and the outcomes were still the same. So we really moved during the time I was there doing some residency work. We moved from 16-session protocols to 12-session protocols, and the outcomes were still the same. So it's important to think about what you're doing if you can collect outcomes. Because I think you want your work to be evidence-based. You want to be offering the best possible therapy to your clients and at the best cost. It's not inexpensive and not everybody has benefits. So, and even if they do, most people feel like those benefits are precious. So things for you to think about as you make your decisions.
And just maybe to jump off that point, because I would totally agree with Elena on everything she just said, but also from when you're working in private practice, clients have a lot of selection because now, we're also in downtown Toronto. There's a lot of private practices that people can choose from. And so if somebody comes and says, I'm looking for this thing that, and we'll often get very specific requests. And often it is sometimes more in the evidence-based sort of area because that's what their family doctor has recommended. They've said you should go look for, CBT or you should go look for, DBT. And so when you have the ability to say this is sort of, I align with those those principles, it also makes it more easy for someone to then sign up with you and want to work with you as a result.
Yeah, absolutely. Okay, so what about the drawbacks? In private practice, right? So I moved from, as I said, Center for Addiction and Mental Health into private practice. What are the drawbacks, right? And I think one of the things most people are concerned about, certainly I was, is the security, right? When you're in a hospital setting, you're working in an institution, you know exactly when your pay is coming, how much there is, how much vacation you have. And it's very predictable. There may or may not be benefits, depending on how much you're working and where. That can vary. So
I didn't get that. Could you try again?
Sorry, that's my phone responding. But the idea is that for some people, that idea is a bit unsettling because of that instability. In terms of responsibility, yeah, you need to be responsible for all of the clerical details. Some of our associates at the practice absolutely worked very hard for the team, really saw the practice as a team, and they worked hard at generating referrals. People were sometimes very proud to tell us that, they had, so many clients that week asking for them specifically because of a presentation they did, or, a place where they dropped off some business cards. And, so that was part of that sense of being a team and working together and having that reputation and responsibility in the community. So again, for some people that felt like a little bit of pressure. And again, no pension, no benefits. Some practices definitely tried that, but the majority of private practices do not offer a pension or health benefits. And that's often a concern for people when they're making their decisions about pursuing private practice versus working at an institution. Those are questions that come up and concerns that come up. And I think it's absolutely important for everyone who's making that consideration to think about it. And again, it's one place where mentorship can be helpful because you can ask people, what did you do about that? What kinds of options did you explore? What did you learn? And those were definitely things we considered, and definitely things that I don't know if any of our associates didn't ask questions about that.
I might just add to that, I think with the, it's
Please.
Nothing that can't be overcome, in the sense, some people might worry, if I go on a parental leave and I won't be able to claim EI during that period. But there are ways to put a little bit of money aside, each month in a certain fund that would, then allow you to have that money and potentially more money than EI would pay you during those periods. And I think we talk about this a little later, but there are ways to still get health benefits. There are ways to get, disability insurance, life insurance, all of those things that might come along with it. And often you still might end up ahead, income-wise. And in terms of the responsibility, I'll also just say, it depends also the setting that you're working in. So, if you're kind of working in like a larger practice, we certainly try to, we try to take care of a lot of the clerical details for people. So we provide the referrals to people. We, have an admin who does the billing and all of that stuff for people to do. If you were considering doing private practice, let's say on your own, and sort of, doing some work, by yourself, that's where sort of that responsibility does sort of increase, because, for every client you see, you might be speaking to 3 or 4 clients to go through the process before somebody decides to work with you, or when you have to prepare marketing materials, or when you have to do the kind of things that it takes to run a business, that if you're doing it on your own, that can be a lot more work that you do have to consider. But sometimes then if you're working in a larger practice, there are opportunities where, you just can come in, see your clients, book their next session, and then that's pretty much all you have to do. And then, do that again the next day and so on. So they're, depending on the model you're looking at, that responsibility can also vary.
Yep, absolutely.
So
Okay.
I don't see any questions in the chat just yet. So I wonder if maybe we want to move to the next slide.
Okay. So what kind of private practice? And these are questions that come up all the time. They certainly did when I was thinking about private practice, and certainly many of my friends, colleagues, former students have all had those same questions, right? One of the options absolutely is a solo practice. Greater autonomy, there can be more of the business elements, and for some people, it's the way to go. For other people, the idea of a group practice is appealing. So in my experience, I found the group practice idea appealing because I guess there were several goals. What was the goal of opening the private practice? Well, it was really to provide service to as many people in our community as we could. Even when we opened a practice in 2002, people were looking for help, and they were looking to the private practice area. So in the private practice, we really worked hard to try to get associates who worked with, so for example, my own experience, my background, I worked at an anxiety disorders clinic. I worked at a psychological trauma program. I also worked on the first North American clinical trial for CBT for psychosis and the first for CBT for bipolar. Prior to doing my PhD in clinical psychology, I worked as a registered nurse, and a lot of my work there was in inpatient mental health. Because I had that experience, people did recruit me to work on these unique projects, like the first, CBT bipolar, CBT psychosis. And I was very happy to do that and to, apply the psychology and the nursing and see where we would get. So I could already offer training and supervision in those areas. But what we wanted to add was somebody who could do couples therapy, somebody who could work with children and adolescents. If someone like Noah came along, wanted to work with psychosis, I could supervise. If someone like Vitas Belivas, who worked at our practice, came and really wanted supervision in bipolar illness, we could provide that, right? And so that is how we built the team, but it was with the goal of really being able to help our community the best way that we could. And that was, a consistent goal. And that is how we built our team. So what we wanted was to provide a lot of opportunities for our coworkers and a lot of opportunities for our community to get the help they were looking for. In the group practice, what we really hoped to replicate was the opportunity to interact with colleagues. Our associates, we didn't want people to work in a silo and not have opportunities to interact with colleagues. It was one of the things that I really loved about working at the Center for Addiction and Mental Health, because I could learn from so many other departments, from so many other disciplines, and from so many other psychologists. So we set up within the group practice opportunities for our associates to actually attend, regular in-service meetings, with other associates, because they could learn from each other. And not only did they learn from each other, but they were able to consult with one another when they had a client. Anyone working in clinical service knows, a client may tell you they're coming in with depression, but it's not until you do a really thorough assessment that you determine it's generalized anxiety disorder. They didn't know that, but as the professional, you could sort that out, but you could consult with people who have expertise perhaps in an area, or something else shows up, right? and the client doesn't want to work with a new provider. They want to continue working with you to provide the best possible service. You have a whole group of professionals that you could consult with. And that was important, right? In addition, right, it added a lot of different referral options. I often said that, in cognitive behavioral therapy, we were taught that discharge begins at session 1, right? So you're discharge planning because you're doing short-term evidence-based interventions. You weren't planning to do kind of a therapy forever model. And so, when we talked about discharge planning, we talked about that, beginning in session 1. And we really encouraged all of our associates to think that way as well. But we also encouraged people to think about the fact that all of your interactions in the community, right, are about building networks and letting people know who you are. It's about building consultations and about being professionals all the time. Fewer business elements. Again, in the, in the group practice, you could also sort of delegate. People who had different interests and different strengths, could take on, again, different parts of the practice, but also we really tried to work hard to generate enough income to be able to pay people to help the associates, right? So whether it was, fielding some of the referrals, but helping with the bookkeeping, the accounting, the billing, all of those things, and all of the work in the background, the technical support, everything we needed. So in a group practice, you really might not need to spend as much time on those things. You could really focus on doing your clinical work and closing the door at the end of the day and going home. Opportunities for growth in a group practice, we thought that was important, right? Again, those were elements that we appreciated in, the hospital settings, the institutional settings, whether it was universities or wherever we had worked. We wanted to provide those for our associates, and most people appreciated those. Did they want to get training in a particular area? Did they want to, be able to consult? We also offered consultation groups, treatment groups, assessment group. So all of our associates could continue to build their skills and build their clinical knowledge if they wanted to work with a new kind of population. Those were things we tried to provide. If they wanted to head up something within the practice that was of interest to them, we encouraged people to approach us. If they wanted to co-teach in the community, I co-taught with many of my students. Not only was it a great opportunity to see them in action, a great opportunity for me, I always felt that clinical psychology was extremely competitive. I hope most of the people, listening, to this talk will recognize and agree with the fact that, being able to work in clinical psychology, it's an extremely competitive field. And I had an opportunity, I felt, to work with incredibly talented, incredibly intelligent, compassionate people. So to co-work with those people was a gift to me as a director. Hopefully, that was a benefit to them as well. And then, people could co-teach, co-present with other people in the practice. So again, wonderful opportunities to give to other associates and to share with them.
And I might just, just sort of add in there. I think, for me, I sort of went right out of residency into a group practice. So a lot of those interactions and the ability to consult with people, I mean, especially when I was, sort of fresh out of school and, maybe hadn't built up quite the confidence yet. That was really great to know that I had people that I could ask questions to, that I could participate in the consultation groups. And that was actually a really important element for me. And so there were other places that sometimes I've been where, it might have been a group practice, but I would sort of show up, the door would be locked, I'd unlock the door, I'd be the only person there for the whole day, I'd lock up and leave. And for me, it was kind of lonely. And like, if there was a difficult client or question I had, or like, that was an interesting presentation, there wasn't anybody whose door I could just sort of go to and say like, hey, what do you think about this? Which, when you are in a group practice, that does enable sort of having that networking ability, that consultation ability. And, at our own practice, we always had that ability to sort of do that. When COVID hit and we were all sort of working from home, we found that it was sort of feeling a little isolating for a lot of us. And for those of us who sort of really enjoy that group element, we actually formalized sort of, consultation rounds throughout on a weekly basis, because the idea was it became such a great opportunity to discuss cases, but also even to check in with how we were all feeling. And so, we would find that there would be a lot of similar issues that sometimes we were having ourselves when, clients were talking about how they're feeling lonely or so on. And a lot of us might be feeling stuck about how to help them, because we were all isolated and we were lonely too. And when you're sort of doing it on your own, you may not have those people to bounce that off of. And I know for myself, certainly, then hearing that, oh yeah, I'm struggling with that too, or I'm pretty lonely too, or I don't really know what to tell people about that, or, I feel maybe ineffective, that at the end of the session, they're still feeling not great and I couldn't really do much to make them feel better, but it's the nature of the circumstances we're in. And to be able to share those thoughts and have those experiences was actually really helpful for me as a professional to be able to do that. And in some group practices, a lot of them do include that, some of them don't. And so that's something, if that's important to you, you want to sort of check out to see if that's available or not. And I would say also those opportunities for growth, as Elena said, I myself would go out with Teach with her and so on. And that allowed me to sort of eventually move into teaching. And here we are still co-presenting together, 10 years later. And it's a great sort of way that sometimes when you do work in a practice, there are, I find it can kind of go in two ways. There's a point where as you get more autonomous and you get maybe more experience, you sort of, your income can go up, you can sort of, but then there's sort of a plateau. It's hard for practices to raise income unless they're also raising the cost to the client. And so there are some places where you sort of get as high as you can, and then you just sort of will stay at that level. And if there aren't really any opportunities, and that, by the way, that's a great model for some people, but if you do want to be able to sort of take on other things, grow in other areas like teaching, one of the things we try to offer is to sort of see if, like Elena said, if people have an interest in a certain area, is that something they'd like to take more responsibility for? And so there are times when, you may find certain places will plateau. There are times when certain places may have more opportunity. And again, depending on what you're looking for, you may just want to check out what sort of opportunities are available if that's the route you decide to go.
Yeah, absolutely. I think, kind of just to add to what Noah was saying, I mean, Huyan mentioned in my bio that I did international work, and I certainly did. I did a lot of training and educating, across Canada, in the US, but I also worked in Sri Lanka. I also worked in India. I also worked in Ethiopia, because for me, it was important to kind of extend our knowledge, in terms of clinical services in areas where the need was high. But they didn't have a lot of training, educational opportunities. So working in private practice doesn't ever have to restrict you from being creative and looking at other opportunities. And in a group practice, my clients knew that if I was away for 2 weeks, they had people they could contact in the event that they needed some urgent intervention. Many clients could tolerate, as you would all know, and you would all want to know, a couple of weeks of someone being away. But if it's 3 weeks or 4 weeks, right, that's a bit long for many people. So, I tried to make sure my clinical load wasn't too big if I went away for a month to teach in Ethiopia. But I still, took those opportunities to help in sort of our greater community. Knowledge dissemination and so on was really important to me. And working in a private practice doesn't have to limit you from taking on any of those other things, right? So I think in a way the group practice for me was also important for those reasons, right? That was part of not just teaching in places in Northern Ontario, but like I said, across Canada, in the US, and then even in the world. And there are opportunities, and those will still come up. If you want to do those in a group practice, there's a bit of security about, knowing that other people can sort of, can pick up while you're away, right? And I think also thinking about a solo practice, you want to think about who will be available to your clients, should they need somebody, when you're not there, right? So in a solo practice, you still need to be responsible for the clients and have a plan about how does that get covered when you're away. In a group practice, it would be a consultation with somebody down the hall or a couple of people saying, I've asked these clients to contact you if they need help when I'm away. I've asked without disclosing the names, but, and you'd have to think about that because part of group practice, sometimes you might be seeing somebody who doesn't want Noah to know that you're seeing them, for example. So, you have to make sure to think about that, but it's very doable. So you've got that backup, and you still have an opportunity to, go away for significant times and do all kinds of other additional interesting things. Noah?
Yeah. And I guess just the next point there about naming the practice. The name can be a lot in terms of sort of your branding, how you choose to present yourself, because that's what people are going to see at the beginning. And there are different ways that we've seen people, brand certain things. And, we sort of took the downtown psychology clinic because we figured, hey, we're downtown. But, there are considerations if you want to name, for example, out of a particular location. So if you became the, Front Street psychology clinic, that would really restrict where you might be able to locate your practice. If for whatever reason you had to leave that space, would it be easier to find something again on Front Street, or would that be more challenging? If you moved and let's say you wanted to relocate and wanted to kind of move your practice a little bit closer to perhaps where you were, would that be doable, or would you kind of lose all the years you've put into that branding and people knowing you as Front Street, and now you want to be, Eglinton Psychology Clinic? And would that cause any issues for you? Some people will name a practice after themselves, so they might want to call it like Lazar and Associates, for example. The question there sometimes becomes, for associates, it doesn't necessarily give them a lot of opportunity to kind of maybe shine through. Sometimes it does, because then you're branded under another person. So if it was Denisoff and Associates and Lazar here wants to kind of, make a name for himself, how does he do that if he's sort of, now I'm talking about myself in the third person. How would I do that if that was something that I wanted to sort of also people to know me? What happens when Denisoff retires? And now I've worked at that practice my whole life and she's retiring. Do we still call that and let's say if I wanted to buy the practice or I wanted to continue working or take on those clients, do we now leave it as Denisoff? Do we call it Lazar? If everybody in the community has known it as Denisoff Psychology for the last 20 years, do you lose a certain level of branding that comes with that if we all of a sudden change the name to Lazar and Associates? And also, as with CBT Associates, another way of branding is branding it based on the type of therapy you do. Another option is to kind of come up with something just very different, like you'll see other clinics like, where it's not, I can't think of a good name right now off the top of my head, but, like Path Forward Psychological Services or something like that, where it sort of keeps it more vague. So do you then have more flexibility to sort of move that around or change ownership and so on as that happens? So whether you're doing a solo practice or whether you're joining a group practice or want to do a group practice on your own, it's something to consider, because that name, once it's been in circulation for a while and people get to know you through that name, it really becomes a very important sort of piece of work that, how does that affect sale later on? How does that affect, you if you wanted to buy the practice, if you wanted to move and so on? Those are all considerations you might want to think about.
Yeah, absolutely. No, it's an excellent point for everybody to consider. And, I can use our example, like, the initial name of the practice was CBT Associates of Toronto. And what happened was that the CBT Associates practice then opened a clinic in Unionville because we had a couple of psychologists who worked there, wanted to be closer to home, and we were happy to accommodate that. And there was need in that community. So another practice opened there, then one in North York, one in Etobicoke, one up in Aurora. So we were no longer CBT Associates of Toronto, and we had to change all of our letterheads, all of our business cards, all of everything, and then became just kind of CBT Associates, right? So I think Noah makes an excellent point as well around succession planning. So in cognitive behavioral therapy, we say, termination begins at session 1. But in a private practice, you want to think about succession planning beginning at the beginning, right? What are you going to do with your practice after you've put however many years into building a practice and building a reputation and building a referral network? That has value. And, I'm from the time when, there was a big private practice in Hamilton and a big private practice in Oakville. And, we talked to the directors of those practices, and everybody had an idea about how to, do the succession planning and be able to have something of value that can continue, because you want all of the clients to continue to have access to good services when you're ready to retire, right? So, just think about how you could do that. And that, as Noah says, becomes part of the name. So CBT Associates of Toronto then became CBT Associates because, the offices were in a lot of different areas, right? So don't limit yourself, and be true to what you're offering. So, we were not shy about saying we were a practice that offered cognitive behavioral therapy, and that became part of the name. But, other practices prefer to be a little more vague, or a little more broad, because they want to offer, more than cognitive behavioral therapy. They may want to offer, something a little bit different or a little bit more, and that's all fine, but think about it at the beginning. It's important. Okay.
And we've got a couple of questions that have come in, but I think some of them might actually be better saved for after we complete a couple more slides. So I might just hold those until the end, because I also So one thing when Elena and I get going, we like to talk. So I want to make sure we also have time to cover all that,
Sure.
the slides and such.
Okay, so then let's move to the next slide. And here it is, virtual or in person. It's a question that is timely, probably was always timely. It was something that, you definitely want to consider. And since COVID, it's changed. So Noah will probably have the most to say about that. But I think what I want to say about this piece is that before COVID, we still absolutely had to offer for some clients kind of a virtual option, whether it was via Zoom. I mean, you want it to be secure. Clients often say, I don't mind, but as the professional, you need to be the one taking responsibility for offering a secure platform on which to offer online therapy. And definitely everybody figured that out, during COVID. But we also accommodated and made time for phone sessions. If somebody had traveled outside of, Toronto, couldn't come in person, but really needed to follow up, absolutely, we would offer those things. It is important. We want to be flexible. We want to meet the needs of our clients. So I think in terms of the in-person, think about your location. Where are you? How can people get to you? Over the course of the 18 years that CBT Associates, that I was part of that practice, right? We moved numerous times. And essentially our first office, we used to refer to as our phone booth in the sky. It was tiny. It was one space. I was there sometimes. Other associates at a different evening or whatever. But as the demand grew and the needs grew, we continued to stay in the downtown core, accessible via the path, because a lot of our clients were people who could get to us through the path on their lunch break right after work, or they could take their lunch break. There's a lot of flexibility in a healthy workplace anyway. So location where, if you build it, they will come, the sort of idea. You don't want to be too far out of the way. And so those were the considerations we made, and they worked very well. Again, commute times, it was part of what we had a lot of people in North York asking us about, can we make something available closer? They would come to the downtown practice, but it was really important that we opened the North York location, because that really made it easier for a lot of people to come there. And in terms of population served, I kind of touched on that at the beginning. We really wanted to provide for our community as broadly as we could. So if that's important to you, then you might want to build a team where you could offer, a lot of different, in our case, it was psychologists at the practice primarily, but we had people who saw children and adolescents, couples, adults, worked with depression, anxiety, psychosis, bipolar illness, really tried to offer as many things. And as Noah mentioned, if there were relationship difficulties and it wasn't, a DSM diagnosis, did we have people who were comfortable working in those domains? How could we provide, as much service to as many people as possible? Again, convenience for self and clients. I guess some people say live where you work. So literally since COVID, I understand that's one and the same. And I'll let Noah speak more to that. The hours available, again, I mentioned it a little bit, but I can tell you I saw clients as early as 7 a.m. because they were clients who worked in downtown Toronto and wanted to come in and meet before they started their workday. And for me, it was about providing service. And yes, I was there at 7 a.m., unless it meant having to cancel a squash game, in which case I thought twice about it. But if I had a client call and they felt like they really needed to see someone, they needed to do it today, and I told them I'm booked solid till 9, and they said, that's okay. If you'll see me at 9, I'll come in. I probably stayed and saw them. Is that a good model? Not necessarily, but sometimes being available to clients was important. In the practice, we definitely said 9 to 9. But again, I think you all know as clinical psychologists, if somebody really needs to see you and you're able to, sometimes it's pretty hard to say no, and you might make some exceptions there. Again, virtual or in person, as Noah said, even if you're working in a solo practice and you're the only person there, or you're working in a group practice, but the times are divided and you're the only person in the office at that time, it could be a bit lonely. The collegial interactions were important to me. I really enjoyed seeing everybody at their practice, saying hello, maybe grabbing lunch together, maybe consulting after work. But, the collegial interactions were a big part of my professional world, and I valued them immensely, and I still do. And costs, again, always something to consider. And that's been changing, so I'll let Noah speak to it more. But downtown office space was absolutely always expensive, and then more, and then kind of less during COVID. And, we'll see where it is now because I'm no longer part of that sort of picture. So Noah, I'll hand it over to you here.
Yeah, I might sort of just to expand on that and give you a bit of my experience. So when obviously COVID hit, everybody went virtual. And initially, I think so many people were used to being in person. And it was just a typical thing that you did. You went to see your therapist in person. I would say, even though virtual was always an option, I would say 98% of people, the expectation was that they were going to be coming in person. And initially, there was a lot of resistance to that idea of doing it virtually. And a lot of clients would cancel and say, I'll wait for things to open back up. I'll wait for in-person appointments to be available. And as we all know, that didn't happen in a very quick way. And so a lot of people got very used to doing virtual work, virtual appointments, because it was really the only thing that was available. When you're working virtually, the data suggests that it's equally as effective as in-person treatment. So if I'm doing a video call with somebody over Zoom, it's not that much different from being in my office. There are some, depending on the kind of therapy you do, it may affect that consideration. So, virtually you can only see from here up. So if it would be important to you to know what the person is doing with their hands, are they being very fidgety and so on, that might be something that you want to consider. And also from the perspective of the kind of clients that you see. So, there are sometimes when you're doing virtual work, I've got people making coffee. I have people who are driving. I have people who are, I can see in the reflection of their glasses that they've just pulled up their email and they're answering emails and then they put it back down. So depending on the populations that you work with also, virtual versus in person may be more or less beneficial to the work that you're doing. The virtual does add an enormous convenience. So even when people are working in office, they can just find a room or close their door. They don't have to walk 15 minutes to get to you or find parking or take transit, then do their hour session, then do it all in reverse, which might take 2 hours out of their day. There's certainly a benefit to someone just clicking on a Zoom link, close the door. They could literally do it over their lunch hour. And some people prefer that because they don't have to explain why they're disappearing for 2 hours. They just do it over lunch. Nobody's the wiser. So there is a benefit to the clients in terms of the convenience, in terms of, commute times and all of those elements. What we are finding is that there has been sort of a steady shift towards people requesting at least the availability of an in-person clinician. So when we look at our data, we don't have as many people who say, I just want virtual, or I'm okay with somebody who only works virtual. We get, and that's not to say, I think when I look at the data, we're probably at about 80% of people that we speak to want some level of in-person component. Now, the interesting thing is that I will tell you 80% of my sessions are not in person because maybe they meet with you a couple of times in person, or they just want to know they have the option to do in person or something like that. So from my experience, and I can only speak for what I see, and I'm sure it's very different across the board, the clinicians that we work with who are doing only virtual, it's harder to land them with referrals than somebody who's able to offer in person. Because if you're offering in person, you can always do a virtual session from the office. So the moment somebody has in-person availability, it tends to be much easier to match them with referrals. That may change again. The landscape seems to keep shifting. So we're always trying to track data and sort of see what is sort of happening. The other thing I also mentioned with virtual, you can reach out to anyone. They don't, if I'm working in downtown Toronto and somebody's in Thunder Bay, they can book an appointment with me now. And so it does expand the access that people can have to come work with you, and that can also in some ways then also expand your referral flow, because you're not limited to people who are only going to be able to commute within half an hour. But it can sort of be I guess the flip side of it is it can sort of be I think I totally just lost my thought. So I'm going to leave it at that. It does allow for additional people. Oh, that's what I was going to say. But what we're also finding is, when people are looking you up, depending on how you've branded your name, for example. So when people type in, Thunder Bay psychologist, we're not coming up on the top of their Google search anyways. Now, while we do have people certainly that we see across Ontario, if somebody's typing in psychologist Toronto, they're more likely to land with us as part of their Google search. And if they're in Toronto, they're more likely, it seems lately, to be requesting more of an in-person element. So it's something to consider. I also will say, I know other people who do have exclusively virtual practices, and they do very well for themselves as well. So it really depends on, what your referral flow is needed. If you just need to see, as a private practitioner in solo practice, you just need to see 10 clients a week, you can probably pull that off virtually. If you're hoping to see 20, 30 clients a week, plus have referrals for associates, you might be more pushed into needing an office space as a way of ensuring that you can capture a larger referral flow. So that's been our experience since COVID.
I think one thing that I do want to add is you need to consider, situations with each individual client. So it wasn't uncommon for us to have adolescents who would ask, will their meeting with their psychologist, be private, because a parent might be coming to the meeting with them, and is the waiting room far enough away? So think about how that translates to like doing it from home, right? So are people safe? And those people often want to come in person. So adolescents, maybe if there's spousal abuse, right? They don't want somebody being able to maybe hear what's going on, through a door or whatever it is. So the in-person, right, may really be an important piece for your clients. So check it out. If it is really important for the clients and you don't have the ability to offer that, have a good network of referrals. We always had so many psychologists who were our friends and colleagues from grad school and from CAMH and other, places that we had worked. We had a network of places we could refer to, and don't be shy about being generous, because you can refer out to a couple of your friends and colleagues and so on. But I've always had the experience that the number of referrals that come back to you for that, it pays back, right? I mean, it's really, really worth being generous, because generous comes back to you, right? So think about it. If this person might be better served by someone, in person, right, where they can actually have that option, refer out. And those people will refer back to you. At least that had been my experience for 20 years, right? Good. Noah?
There we go. Oh, did I skip one? No, there we go.
All right. Finances of a private practice. I still remember taking my own money and putting the deposit on a rental space and thinking, what in the world is going to happen next? Am I just, losing this money? And of course, that was never the case. It just kind of kept going in a positive direction. Your income can be more unstable. What I always encourage people to do, what I had to do was, just really be mindful for several months about how much comes in, what do I need to earn, what are the patterns of referrals, made guesses about, I think summer vacation is going to be really slow. And in fact, summer was not very slow, things that were influences on the income were things, summer people might be back from school, from university. So people were still coming in to see psychologists. It wasn't like the private practice, referrals dried up. Around some holidays, you might think people don't want to see their psychologist. In fact, that was the opposite. A lot of people might have felt somewhat lonely or, excluded, and they were really happy to have somebody they could come in to see. So what you end up doing is kind of figuring out that overall your salary over the year will be pretty stable. I know we definitely had some months where the income fluctuated, even for the whole practice. But overall, everybody did well. We had many associates at our practice, and there were people who were nervous every time we announced that we were bringing on a new associate. People were nervous about the income. And what do you mean you're bringing on a new associate? Will I still get enough referrals? And we always told people to let us know whenever they didn't have enough referrals, whenever they had openings in their practice, we would work even harder to try and fill them. And nobody complained. In fact, our associates were friends with one another, and I hope continue to be friends and have a network of practices, where they still interact and help each other out. So yeah, people figure out how much income they need, how many clients to book. Yes, we all get some cancellations every week. And we also get some people calling back who say, could you please fit me in? Something just came up. I really want to come in this week. And lo and behold, it kind of averages out, right? Other financial.
With the, sorry, just to jump in with the
no, please
pattern
do,
of
Noah.
referrals. It also speaks to just in general, depending on your populations, it's always a good idea to track data. So, one of the things, as I mentioned earlier, I'm kind of a numbers guy. So I'm always looking for patterns in the data and especially when you compare those year over year. So for example, like I can say, there are 3 months for us that tend to not always be as good, where referrals sort of go down, and fewer people are booking sessions. And that tends to be February for some reason. That tends to be July, probably I'm guessing summer vacation. And that tends to be December because a lot of people are taking time off and going with family. And so you can also consider for yourself, like that may help you decide, and be prepared for, because, when I first started in private practice, I get very nervous if I had a month that wasn't as good as the last one. But then the next month would be better. And then, as Elena says, it all kind of stabilizes out by the end of the year. But if I know July isn't going to be as good a month, maybe that's when I decide to take my vacation, or maybe that's when, just for me to be mentally prepared that, so I'm not getting too nervous about that. that can also be beneficial. And so there are certain patterns, and again, that'll be different depending on your populations. If you're doing more assessment-based stuff, you're probably going to find big peaks around exams, around the start of the school year, because people are looking for accommodations. You might find certain months people aren't as motivated to get an assessment, for example. But then other times you're going to be swimming and feeling really overwhelmed because you're overbooked. And that was one of the strategies I often used, was if there was a certain number of clients I was hoping to see, knowing there'd be cancellations, knowing there'd be people who say, hey, can you squeeze me in? If I wanted to see about 5 a day, so 25 a week, I'd probably book for 30. Because you will, and again, we have the data to support that, in our clinic, the cancellation rate is about 15%. So you might want to expect that of all the sessions you book, 15% of them aren't going to actually turn into income for you. And so again, then, like Elena said, you decide how much you need. And then if you know that 15% will cancel, that can also allow you to decide how many people do I need to sort of keep on my caseload on a regular basis. And when you keep track of that data, it really allows you to make very informed decisions.
Absolutely. I think it's also, just reminds me about the cancellations or the no-shows where, what do you do with that? That's, that really kind of is a question about, that overlap about being a psychologist and being a business person. In private practice, you are a business person, right? So I know that at the Center for Addiction and Mental Health, no-shows were not in any way billed or, penalized. I mean, we checked to find out what happened, but in a private practice, it's a little bit different. And it's a little bit, at least for myself, uncomfortable. And somebody just doesn't show up. We have it in our policy, had it in our policy, and we really made it clear to people that isn't really an option, because despite having many associates, we often have somebody who could really use that time. And also out of respect for our associates, we don't want our associates in their office coming in, they're waiting for somebody and then they have no pay for that. So our policy was that if you didn't give 24-hour notice, if you gave 24-hour notice, chances were we were able to slot somebody else into that. So there was no loss of income. If it was a no-show and it was an open hour, then we billed for it. And I'm not sure how NOAA does it, but I can tell you it never felt really quite easy or comfortable. But we discussed it. And I had people who were professionals who insisted on paying even when, so we did have some exceptions. If it was a medical emergency, if their child had a medical emergency, there are exceptions to consider. But I had clients who insisted on paying me, even when I said there is no need to pay me in that situation. You couldn't have prevented it. I understand that. I respect that you called and let me know. We'll figure that out. But they would insist on paying. So again, definitely something to think about, because those last minute sort of no-shows versus cancellations, they are part of the business.
And that actually just came up in the chat. So that was a very timely thing to mention. We do the same thing. So we have a 24-hour cancellation policy. It's not comfortable. Usually, we let every associate decide. I usually let the first one go, because, just as a reminder, it serves as a conversation point. And sometimes stuff happens. Like if someone's in the emergency room or, they're in the middle of a car accident and they can't make the session, you want to have a level of flexibility, because you need to sort of balance both the clinical component and providing good clinical care with the business elements, which is that if you had a client who repeatedly canceled within 24 hours, and you weren't able to rebook that spot, that does have an impact on your business side. And so it's how do you sort of find the balance between the two? I've also seen as of late, there are some who will also require a 48-hour cancellation policy. And then you may want to decide, does that have to be 48 business hours? So if they have an appointment on a Monday, they really have to cancel by Thursday. They can't cancel on Saturday to sort of cancel an appointment. Some again, depending on what you do, it also depends on your clients. So, some people would probably push back and say, well, if it's 48 business hours, how was I supposed to know on Thursday that I was going to be sick on Saturday? And then I called you on Saturday to cancel. So you kind of want to decide what makes sense for you and your clients ultimately. But it's always that balance, I think, of clinical care versus sort of the business element of it, which is that does affect your income if you don't have enough notice to book somebody in.
Yeah, absolutely. Also consider putting money away. It's not uncommon where, associates or just other professionals have talked to me about that point. The money you're bringing in when you're working in a private practice doesn't all belong to you. And so think about that from the beginning. You've got your taxes to consider. You might need to put away for savings or retirement or healthcare. If you have a partner who has health benefits, that's not something you have to think about so much. And many people would say that, but absolutely, have a good bookkeeper, have a good accountant. And I would always tell my accountant and bookkeeper, I love surprises, not when it comes with, in terms of a tax bill. So I do not want any tax bill surprises because it's painful to work really hard and then get this huge bill that you didn't anticipate, and you did something else with the funds, invested them somewhere or whatever. And it's like, can you just tell me these things in real time? If I need to pay something monthly to CRA, let's figure it out. And also putting aside for the savings, for the retirement. In terms of healthcare, there are self-directed health plans. Personally, I had Medicaid, not to say it was good or bad. It was just one that worked for me. So, I had to put the money in. It was self-directed. I could use it for certain things. It was managed by them. You could adjust it annually, just different things to consider. But, something to think about from the beginning. If you're good at that, you're good at that, and you know what I mean. And you don't need more explanation. If you're not good at that, if you have questions about it, start asking your accountant and your bookkeeper or your colleagues or a mentor that you might have, because you absolutely need to consider that so you don't get those unwelcome, unwanted surprises. Like I said, financial bills are never comfortable, unwanted surprises for me. And if you're working hard and your income is good, those can be numbers that you just don't want to see.
The insurance, as Elena was mentioning, she had the Medicaid. I, for example, have bought like private health insurance, and it's not as nice as sort of the public health, because they'll exclude you for a lot of the conditions that are pre-existing conditions because it's just you. So I think of it more of like, whatever I'm going through now is going to be excluded, but if something ever came up down the road, I might have insurance for that. I also buy critical illness insurance and disability insurance and life insurance. And although those can add up, because when you do it privately, just you, it's typically more expensive per person than you would do if you had it sort of pooled, for example. But they also do have some benefits. I do sometimes some return to work stuff, and happen to be talking with, one of the rehab consultants, and, I happened to mention, oh yeah, I just signed up with you guys with this. And she said to me something like, oh, that's really good, because when you do it privately, it's pricey, but you don't actually have to comply in your rehabilitation. And I was like, oh, what do you mean by that? She's like, here, if they refuse to see their psychologist, we cut them off. Whereas you could say, I don't want to see a psychologist, and there's nothing they can do. So the contracts are also a little bit different in terms of, you may have a more premium thing if you're doing it on your own versus one that's organized through the company. And I've found just just speaks to the next point, but it's also a write-off for your business in some cases.
Yeah.
So it works itself out in.
And I guess, I don't know where, what you have done or not, Noah, but I think that idea, I know at CBT Associates, there were questions and considerations about offering people full-time positions versus, keeping everyone as a subcontractor. And there were also discussions about, and in part because people wanted to know if they could get benefits through work. And so if there are large group practices out there, I mean, those are things people could think about and look into. Some people offer them and some do not. And it's tricky, but everybody has their unique individual needs. And, those are things to think about for everyone, right? Whether you're the employer, whether you're thinking of joining a practice, those are all fair questions to ask. Additional insurance, health and disability, Noah mentioned. Business write-offs, again. My recommendation to people is to work with an accountant, and there are many, or work with a bookkeeper, and there are many, I assume at this point, who really have worked with professional psychologists, because there are many different write-offs. I am not a business person. When I went to graduate school, I did not get any training in business. I had no idea about these write-offs or cell phones or, internet or health insurance, all of these kinds of things, educational, renovation costs, whatever, right? Home office space. There are lists of things that somebody could claim, transportation, vehicle, whatever, right? Get a good bookkeeper or a good accountant. They know those things. We're not supposed to know those things. We know what we do and we do it well. They know what they do it well. Look for someone who has experience. If you don't know somebody, ask a friend, an associate, a mentor. Who did you work with? Interview a few people, see what they tell you. Who do you fit with? But people know those things. All you need to do when you're thinking about going into a private practice, is to find out what those are for you. I remember at the private practice, there had been an associate once who asked for a receipt for rent to submit. And the associate was not paying rent. The associate was getting paid for the work that was being done. And that was just a pure misunderstanding on the associate's part about, what the difference between what was billed to the client and what was paid to the associate, was covering. But no, the associate was not paying rent in the kind of practice we had. So, again, for everybody, ask the questions, ask if you're working on your own, if you're working in a practice, just know about all those pieces, get someone good to work with you on that, bookkeepers and accountants. And then make sure you can have a really informed conversation with the people you're working with. And whether you're a director or whether you're an associate, those are things that everybody should know and be clear on. So learn from my mistakes, so that you make sure those are conversations you have.
And there's a question in the chat that I've been holding for later, but it sort of is like, how do you learn about all the responsibilities in being in private practice? And I think in part what Elena's sort of saying is sort of this, that we learn from the experts, whether it's mentorship, I would say I learned a lot about working in private practice by working in private practice, but also from the professionals, so here I was, if I took a taxi to work, I was like, oh, that's a business expense. And then my bookkeeper is like, no, it's not allowed if you're going to your office. It has to be if you're going to a client's home, for example, for a home visit. You can't claim parking if you're going to, your clients, going to your office. But if you were parking to go to a meeting, that would count. But there are a lot of good write-offs that, whether it's your registration fees for the college or other things like that. There are a number of different places where you can sort of reduce your tax burden a little bit by claiming these expenses, which may not be always expenses you can claim if you're, working in a different setting where you're salaried and so on. So you kind of get that trade-off a little bit of, maybe I get insurance and pension over here, but I can write off a lot of my expenses, like a portion of my cell phone, a portion of my rent if I have a home office, my conferences that I attend, my insurance, all of that stuff. So sometimes it all comes out in the wash in terms of what you save versus what you may have to spend a little more on.
Absolutely. Yeah. Considerations of incorporation. A lot of people have over the years asked me questions about it. And certainly I was incorporated in terms of professionally. But I think the idea here again, have a good bookkeeper, have a good accountant, have people who understand what it means, what the details are, and could do kind of that closer look of exactly what's going on in your practice and whether or not it's beneficial for you. So for me, it was beneficial and I appreciated that. You have to remember that when you do that, you do have costs to being incorporated. You do have, to have an accountant submit, for the incorporation separate from you privately. So you're not the incorporation, right? You're still who you are, but your incorporation is a separate professional entity. So there are costs associated with it and there are benefits, but there's no one clear, like, yes, everybody should or no, nobody should. It's worth it for some people at a certain point. Noah?
I think sometimes the general guidance I've received on it, because I also am incorporated myself.
Yeah.
The idea is if you take what you need to live, and that's going to get taxed, let's say, I don't know, 40% when you sort of receive an income personally, because that's your tax bracket, let's say. If you, let's say, need 100,000 to live and you make 100,000, it probably doesn't make sense to incorporate. If you make, let's say, 200,000, but you only need 100,000 to live, what can happen is your professional corporation can then bill the clients. The corporation collects the 200,000. There are different ways to do it, but you essentially get paid your 100,000, and that remaining 100,000 sits in the corporation. And business taxes, you won't get that money taxed at 40%. I think in Ontario, it's something like a total of 16.5%. So what happens is you have more money that can be left there. Of course, if you take it out, you'll get taxed at the full rate. But if you leave it in there, you might be able to invest it and you have a little bit more to invest. The other thing is you can sort of accumulate it in there over time. And so I often think of it as that's going to be my pension plan is. So when I retire, let's say, knock on wood, I'm still with it at 70 years old. If I retire at 70, I can still be an employee of my corporation till I'm 95 and continue paying myself a salary for the rest of my life. But you're taking it out in a way where perhaps the tax burden, again, you're not topping out at the top tax rate. You might be topping out a little bit lower because you're taking a little bit less personally. So talk to your accountant about when it makes sense, but that's often been the general guidance. If you make a good chunk more than you actually need to pay yourself, it's not always a bad idea.
Absolutely. Yeah. And as Noah said, both of us ended up choosing to be incorporated at some point. It made sense. You can't avoid taxes. Some are deferred, but there are ways to use the funds that are in the corporation to really earn money. And like Noah says, you can pay yourself after. Good. Should I open my own practice? Okay.
I just want to also note that we probably have about 25 minutes left. And some questions.
Yeah. Should we go through this fairly quickly? I think some of it, as we anticipated, some of it would have come up already. Considerations around the model. We talked about that, group, solo, and partnership. The idea there is many people think about a partnership. You want to think about what's the other person bringing, what are you bringing, what's the value in the partnership. For some, it's a value added, but I know many people have said that, for them to take on a partner would really only amount to a significant decrease in their own income, because you would share any additional profit with your partner. So if somebody has a practice and is doing well, they might not consider a partnership. There are definitely benefits, in terms of breadth of what you might offer. Also, I would say it's important to understand that it might be good not to have a partner who's like a best friend. And in part, it's because often when you're away, right, your partner is covering the practice. When your partner is away, you're covering the practice. So when you think about partnerships, you think of a good, healthy, strong business partnership, not necessarily, a best friendship. And those are things you can figure out. Many people have solo practices. They're happy. They're successful. They like to do it that way. They know that it means a lot of unpaid hours. They're good with that. And group practices, I think Noah and I have both spoken to some of the reasons why we both worked in group practices and the things that we really, really loved about them. There are many benefits, and you could build those in, and that's really important and appealing to some people, right? The kinds of costs, well, most people figure that out quickly. The rent, the phone, the internet, record-keeping software, marketing, legal, accounting, right? There are a lot of costs in a practice. So, there were several people when we had CBT associates, people contacted me, asked about working in the practice, and asked how much an associate would get paid. And we were very honest about it, and we were very fair about it. We didn't have favorite associates, less favorite associates. This is what we were able to pay. And we always tried to pay as much as we could. And what I really liked is when, some of my colleagues went off and looked into how much would it cost to cover all of the costs, the rent, the phones, the this, the that, the advertising, different kinds of things, and came back and said, I would be delighted to work in the practice because they really could come in, do their clinical work, their paycheck arrived, and they didn't have to do all of the other work, but they understood that they were really getting paid as fairly as they could. And when somebody knows that, I think it just feels good across the board. And then again, the unpaid hours, like we said, everything from, really like expanding, renovations, soundproofing, different systems, again, bookkeeping, all of those kinds of things. Even about where do you get your, potential referrals, right? Some people are nervous about where will my referrals come from. And I encourage all of you, I hope some of the people are new to this and just thinking about it, just remember your referrals will come from every interaction you have, starting from, last week. Because I had worked as a nurse. I had worked as a research nurse, in Toronto before the practice opened. And my friends and colleagues from nursing, from research, from CAMH, over all of those years, people continued to refer to me because they knew me to be hardworking and ethical. And, and people would ask me, like, this is a very special client. Can you fit them in? The answer was all of my clients are very special. And yes, I'll fit them in. Did I end up working a bit too hard? Maybe. But we also expanded the practice. We had a team and everybody worked hard. So things absolutely to consider.
And just if I can jump in there for one quick sec, because a question also just came in about how do you market? And I think that sort of leads to sort of building that referral base.
Yeah.
And that idea of working on the business versus in it. In it, if you consider those are the clients you see, that's where you're kind of making a lot of the income. But on it is all of the other stuff when you're doing the data analysis, when you're fielding referral phone calls. And, again, our data suggests, there's a lot of time that can go into just talking to people about your practice and getting a sense of what they're looking for, and they don't book with you. So there's time that you have to put aside for that you don't get billed on. And the marketing networking and getting the referrals, sometimes that can be as simple as, putting Google ads. There's a cost associated with that. But a lot of the times, I think when you do good work, and the data that we have sort of supports this, there's a substantial number of people that are referred because their family doctor knows of your work because you did good work with that client. And so they will send another client to you. Or even sometimes that client will say, you know what, you should check these people out because I had a great experience with them. So often it can be other medical professionals who've worked with you. I and Elena as well spent a lot of time teaching. So, I would teach a lot of courses at various organizations or in the community. That's how people started to know who I was and would say, oh, he sounded interesting. I have a client, I'll send to them. Or, oh yeah, I heard that guy talk. So there's different ways of kind of building that network. There are referral databases, things like Psychology Today, Lumino Health, where they keep databases. You search for psychologists in a geographical area, those people in the area pop up. There are ways, you can send mailers and flyers to, doctors' offices and people that you think would be good referral sources. Our experience, I think, has been that doesn't translate into a huge number of referrals. And so it often can be more of a hassle than perhaps it's worth, but it's another option depending again on where you work and where your population is. If a lot of doctors are busy people, they open it, they throw it out. But there are some, if you're able to do more of a personal connection, that would actually be much better for them. And then they know who they're referring their patients to because they care that they're receiving the best care. So there's a number of different ways you can go about it. And you really want to figure out over time for you which one works best to kind of build your brand, build your name, get those referrals. And for somebody else, it may be a different story.
And I can tell you, Dr. Lazar I don't think he ever left his home without a pocket full of business cards. And he was, he was just really good at sort of meeting people, chatting. And when people know you're a psychologist, first question they ask, I think, was, are you reading my mind right now? And it's like, no, it's not really what we do, but okay. And then they were curious. People are interested about psychology, psychologists, having your business cards, with you to share with people. My family doctor who was in North York would refer people to our practice because she knew me and she also recognized if somebody might need some help. If you get an opportunity to, as Noah says, teach, train, educate, do some talks for different organizations, let people know that you have a practice, let your supervisors from university know, your friends and colleagues, your family members, let them know you have a practice, and as the referrals come, right? I remember seeing a sign, I think it was in the dentist's office, but I always thought it was one that we should all put in our private practice offices, right? If we do something wrong, let us know. If we do something right, let everybody else know, right? So, don't be shy about saying like, listen, I know we're not perfect and talk to me. If I did something that you found wasn't helpful or wasn't okay, let me know, talk to me. But do, as Noah says, a lot of the referrals end up coming from, word of mouth, right? And that's a real important piece to remember. Okay, we'll move on quickly here to getting an assistant. Lots to think about. Over the course of our, kind of 20 years with the practice, we had a range of assistants. We had more full-time, more part-time, but your assistants are really important people in the practice. They're kind of your front-facing people, phone call, spend the time to really get them to know what they need to know to do a good job, to be professional. Yes, if they're in the office, they also are professionals. You want them to just be really good at interacting with all the clients who come in, and remembering we're working with clients and they have a range of presentations, right? We mostly had part-time assistants for a long time, and that seemed to work well enough for us. And our clients knew that as well. If they were there in the evening, just come in, have a seat. Your associate will come out. But again, lots of training on the confidentiality. What can they do for us? A lot of things, forms and keeping things up to date, and filing, and having all of those systems, troubleshooting. You're running into into work with a client, and some of the systems are down. They can just do so much for us. They're priceless. It's really good to have good good assistants who understand confidentiality and professionalism. Many of our assistants were psychology graduate students in training, and they loved getting that experience. We really always enjoyed having them. Bright. So again, that was an important part of it. Responsibilities, models we talked about. Keeping associates, being realistic. We always really liked when our associates were happy and wanted to stay with us. And I think it probably always was a bit sad when people left, but you always knew that that was also part of, I don't know, it's not quite kids leaving the nest for sure, but if people wanted to, move on for various reasons, you really want to manage that very well. Most of our associates who left were very professional about it, and book a meeting. We always discussed clients and how to best manage that, and there are ways to do it, always in the best interest of the client. And as it turned out for most of our associates, they continued to keep in touch, and we continued to refer out, always respectful and professional. If somebody called a month after someone left or a year after somebody left, we put them in touch with that associate wherever they might be at that time, if they were still working and had a practice. So I think all of that was important. And again, succession planning, as we said, starts at day one, from choosing your name, your location, all of the things. You're building a practice, you're putting your reputation on the line. There's value in that. Your clients know there's value. All the referral sources know. Ideally, you find a good way to kind of be able to pass that on when you're ready to retire. Noah?
A couple of things I might just add there. I think, if you're sort of deciding, you want to open your own practice and have a bunch of associates, which is sort of what Elena did and what I eventually did, there are a lot of responsibilities that do come with it, because not only do you have, the financial obligations and so on that we've talked about, but, it's your practice. So you want to sort of make sure that the people who work in it are happy. And that's always really important for me when I'm thinking about, are we able to give this person the referrals they want? Are we able to find them an office space on the days they need? I often view it as like we're just sort of one big team. And so I want to make sure that everybody's having their needs met. And, that can sometimes mean one person's needs conflicts with somebody else's needs. And how do you manage that? Or, I also think about times when COVID was just starting and we had to pivot very quickly to online forms and online stuff. And I remember being up till 4:00 in the morning, sort of writing these things because they had to be ready for everybody else the next day, because they had to be able to send a consent form to a new client, and we just had to have it ready. So when you are sort of leading a practice, it really is important to there's a lot of time spent on running it. And I enjoy that kind of stuff. I really you can probably tell I'm a numbers guy. I like to kind of do all these things. It's a lot of fun for me. If that's not really your thing, you might not want to sort of take on all that additional sort of work, but I enjoy it and I find it fulfilling, and I find it a great complement to doing a lot of the clinical work. And I'll also just say, keeping associates is obviously important because you want to keep them happy. You want to provide opportunities. You want to provide areas for growth and so on. But it's not uncommon either that people do eventually move on. If people are, really good at what they do and they're bringing in all of their own referrals and so on, there's opportunities to consider, whether a partnership model or something might look well. But sometimes people they want to just do their own thing and kind of have it be their own name, on the door and so on. And that's okay too. And I think, you want to be prepared. It's also, you're not, it's not an unusual thing that, if you don't retain, 100% of everyone who's worked with you, that you're a bad boss or director or that you've done something wrong. It's also just part of natural growth. And, there's a question earlier in the chat that sort of asks, how many years of experience should you have before you move to private practice? And how did you learn those responsibilities? And I think, in part, I probably wouldn't have started a solo practice right out of, the gate. Nobody knew who I was. Nobody knew what was going on with me. It would have been hard to get referrals. It would have happened eventually. But one of the great opportunities is sort of learning from the people who are around you. And if that's something that you're passionate about and you want to do, that's often how you sort of learn what those responsibilities are, is you sort of see how it works. If you're able to kind of take on other roles, you're able to kind of get a feel for, oh, right, and you've got to do this kind of stuff and that kind of stuff. And it's a great learning opportunity as well. If that's something you want to do down the road, is to have a mentor or work in the setting for a while first to really get a good sense of what that looks like.
Yeah, absolutely. And I think that as you are considering, private practice, solo practice, group practice, ask those questions. Don't be shy. This is your career. This is your life. You've worked hard. You want to think about the next step. Ask the questions. What opportunities do I have at your practice? Are there opportunities to teach, to co-teach or teach my own area, both in-house, because we had rounds on a monthly basis, but also, out in the community. Are you connected to things that maybe I could be a part of? And, I think when you're joining a practice, just ask what they have to offer you, because, many, many practices are rich in those ways. They arrange to pay some of the top psychologists to present at their practices. They have opportunities in the community with doctors. I mean, we presented to CSIS, the spy agency. They wanted to know about psychology, and then lo and behold, we had referrals about, people who had anxiety. We had requests from other professional organizations because somebody went off, one of the bosses went off with a depression, and they wanted us to come in and teach all the staff about the depression. So, in a private practice, there should be opportunities. People should be willing to share those with you. And as Noah says, you become, richer for it. Your work shouldn't be dull. You've worked hard. You should be able to do what you're interested in. Ask about those kinds of things, because you're just figuring out how to do that. Keep healthy relationships with the directors. Let them know what you need, what you want. And ideally, they'll work with you to make your career as rewarding and fulfilling as it can be. But they'll also be realistic. If they can't, pay more because there just isn't more once everything is covered, they'll be honest about that as well. And ideally it should work for everybody, and relationships should be good even as people depart. And then you still refer to one another, because nobody can do everything, right? So your expertise ideally will still be needed. Maybe their mentorship, things like that. So, be good about it, but make it your own.
So we've got a couple questions in the chat that maybe I'll throw out there, and Elena and I can both sort of comment on those in the last few minutes. One question is, do you have any advice on when to invest in office space or other materials like a test library and so on? I think for me, like if I'm sort of thinking about that, there's sort of that pivot point when you might say, I'm working virtually, I've got a few people, it's working well, but I've got far more people asking if I could come in person. And I'm losing those referrals because I don't have an office space. And so that may be the point to say I'm going to have to invest in one, for example. Other times, the way I've sort of done it in my head thinking is, when we first opened the practice, we had a 7 office space, but there were 3 of us who worked there. And so we had way more space than we needed, but the intention was, let's kind of hope to grow into it over time. And so it was a little bit of more of a financial hit at the beginning. So certainly doing a test library, that's a lot of money you usually have to put up front to buy WASES and WMISs and all those different things that you need. But if that's something you want to do, you may have to look at that as an investment up front, and then that's going to hopefully bring in the returns later if you're sort of marketing your psychoeducational services and so on.
Yeah, I agree with Noah. We did have people who worked with kids and people who wanted ADHD assessments. And, we did gradually over time buy those materials when somebody needed them. But you wanted to make sure you had enough demand for certain things before you invested in them. If not, refer out. But if it's part of the practice that you want to grow, definitely invest in it and then market yourself as that, right? Office space, we started with 1, we moved to 4, then to 10, and then to like 15 or something. So it just kept growing as the needs grew. Always in our practice, the evening hours were in most demand. Our daytime, even over like the 20 years of having the practice, daytime office space was still available. So we encouraged people to come in and, do some learning or reading or whatever they wanted there, or prep work. But the evening spaces were booked solid. And that was always the piece that forced us to expand yet again, because we just ran out of space.
Another question here is, how would you start to think about the services you'll offer in your practice, but in a way that doesn't land you in conflict with other organizations in your local area? So if you worked in a school board and wanted to provide psychoeducational assessments in the same catchment area, is that possible? So 2 things come to mind for me when I think of that. One is, you'd have to look at whatever contract you would have with the other organization. So if you were working in the school, maybe there is something in your contract that says you can't work and do the same work within a certain geographical radius or whatnot. And that's something to talk to a lawyer about to see, how enforceable that is, or what the penalties would be and so on. But my experience has been, especially being in the downtown area, there are a lot of practices in the downtown area. My sense is we're all busy. There's a lot of need out there and a lot of work to go around. And so, if you were to offer psychoeducational assessments outside of the school board, my understanding with a lot of school boards is there are very long wait times to get those assessments. And so for some people, it's a matter of improving access, and it's a matter of taking them off those wait lists. So if somebody has insurance and they can afford to do that assessment, that opens up a space for somebody who couldn't afford to do that assessment. And so there is tremendous need out there. And so I think, it usually isn't too much of an issue if you're doing parallel things.
Yeah. And I think the pieces to remember, as Noah says, you may need to consult with a lawyer, about, what you're curious about there is the conflict of interest, right? And so take a look at your contract and what it says, but essentially you can't be prevented from earning a living, right? So if you open your own practice, you are able to earn a living doing what you're doing. There are many people, we came to know, there are many people who have either insurance, as Noah said, or they have means, and they are willing to invest that into their children or their own mental health. So, when I was working at the Center for Addiction and Mental Health at the Anxiety Disorders Clinic, the waiting list was 3 years long, right? That was a problem, and that's why the group therapy was the only therapy offered. Individual therapy, there weren't enough psychologists. Didn't matter how many hours we worked. And that's just 3 years long is too long for a waiting list. And so, offering individual therapy in the community, actually helped take some of the pressure even off of that. So, again, long waiting list, lots of need, ask a few questions, but usually doable.
So it looks like we're sort of at our time point, so it might be a good point to leave it there. If you have any other questions and you wanted to, I find most people in private practice, including Elena and myself, are usually pretty friendly. So if you have questions or other things, you can always reach out to us, and I'm sure, we'd be happy to answer.
Absolutely. Yeah, absolutely. And my email, direct, elenadenisoff@gmail.com. I'm retired, so I can happily chat with somebody if they have a few questions, and I don't hesitate to do that. So thank you to everybody who did attend and for all of the great questions along the way. Do we have time to stay on, Noah, or you are ready to move?
I actually need to run to another client in the next couple of minutes, unfortunately.
Okay.
But if you wanted to hang out, or Huyan,
well, I'm just wondering. I'm just going to check with Huyan. Huyan, is there a way that people can send us a few questions and maybe we can make those available as text responses? So when they check in to look at it, we might be able to answer a few more, or is that not part of it?
I think we can make it happen, right, David?
Okay.
Is there a way to make it happen, technically speaking?
Sure. Start by, I would say, typing their emails into the chat. Would probably be a good start, and then we can actually, I'm not sure if posting it would be a good idea, but certainly giving people an opportunity to ask us to connect.
Okay.
And yeah, that's good. Connecting with your group would be good too, actually. Yeah, that's a good idea.
Yeah.
So why don't we put our emails in the chat, and then if people wanted to reach out, we can certainly try to answer any questions.
Okay, I think I just did. Let me know if people can see it.
Yep.
All right. Yes, is it accurate?
Yeah.
There we go.
All right.
And that's
I'm happy. I'm happy for people to just ask a question, and if there's any way that I can help, I'm really glad to do that.
Thank you so much for the two of you to have such a wonderful and presentation. I think we have learned a lot from the two of you. And also thank you everyone for attending. And if you have any feedback, so I just post some of the information in the chat box. So feel free to fill the feedback form and also join our counseling psychology group. So we have more professional development webinars. And of course, so the two speakers have shared their email address in the chat box. If you have any questions, feel free to contact them. So thank you everyone again for making this happen. It's really our honor to have both of you to share.
Well, thank you very much.
Thank you very much. It's always fun to kind of share that information and encourage the next generation. And there's so much help needed and so many excellent professionals up and coming. So thank you.
Exactly. Thank you. Take care. Have a great day.
Thank you.
Yeah, you bet. Bye now.